The Caribbean Cancer Research Initiative, or CCRI, is a not-for-profit organization that is working to address cancer prevention and management through research across the Caribbean. In Trinidad and Tobago, if you have to get any study done, you have to apply to one of the 5 ethics committees that is housed in the regional health authorities across Trinidad and Tobago. Now, you have to keep in mind that Trinidad and Tobago is a very small country, so really all studies of high impact should be national in scope. So if I have a national study, I have to apply to at least 5 ethics committees to get approval. And each one of those committees have different processes, different forms, different timelines. There's nothing standard across these committees. So once you're doing research with human subjects or their data, you have to get ethical approval. So ethical approval guarantees or says, it's sort of a stamp that says your study is being conducted ethically and that the protections are in place for the subjects of your research. It is a necessary thing. It has come about based on all the atrocities that have happened in the past with human experimentation across the world. And so it is something standard, it is very much needed, but it also needs to be regulated. So in order for us to really invest in research in Trinidad and Tobago, especially medical research, we have to address the issue of research ethics committees. And there's no way that we'll be able to progress as an organization and have the impact that we need to have if we have to continue to work with the ethics committee system the way it's set up now. It is too laborious, it is heavily redundant, and something has to be done. It needs to be standardized. If we cannot reduce the number of ethics committees, what we can do is come up with processes. So for example, if I have a study that goes across many RHAs or many hospitals, I should only have to submit my study to the Ministry of Health. And once I get approval, the approval should apply across all the RHAs. I think everyone, including the people on the ethics committees across Trinidad and Tobago, acknowledge the fact that something has to be done. And especially the people who are researchers, especially the people at the universities, they definitely see that something needs to be done. I am going to use as many avenues as I can to lobby for improvements in the Research Ethics Committee system in Trinidad and Tobago, because there's no way that I can continue as a researcher in Trinidad with the present system. And the other thing that we're trying to do with the organization is set up or to pilot what's called a patient navigation program in all of our oncology units across Trinidad and Tobago. We just don't do research in medicine the way that we should. We don't have a research agenda. And I think that is one of the missing pieces in the puzzle when it comes to improving healthcare and patient outcomes. I chose cancer specifically because the data right now shows that our survival rate is pretty poor. There are papers that have been showing that our 5-year breast cancer survival rate is approximately 30%, and in the US it's currently over 90%. So there's a huge health disparity gap between Trinidad and Tobago and other countries with respect to cancer. But we need the research and the data to be able to say this is the problem and describe it from an empirical point of view, and then be able to come up with solutions.